Guys, it's Wednesday, so we do Work It Out Wednesdays on this day. And today I gave y'all 3 questions to work through. So I know some people wanted pulmonary and cardiology, so I just did a quick 3 of that. So number 1 says a 48-year-old female presents to the office with complaints of shortness of breath. The patient states that she is waking up in the middle of the night, gasping for air. She states that this has happened 3 times this month, and she explains that it has been so difficult that she has used her rescue inhaler 4 days this week. How should the nurse practitioner treat? So here's the stem. How should the nurse practitioner treat? So based off of this, we got to figure out what's going on. So clearly she has asthma. The patient is explaining this, so you need to think of your stepwise approach. I always say to you guys to look at it as a range. So we have intermittent, we have mild persistent, we have moderate persistent, and severe persistent. In the intermittent phase, they have signs and symptoms less than 2 days a week, so that's not this one. Mild persistent, they have signs and symptoms 2 days or greater a week, but not every day. So possibly. Moderate persistent, they have symptoms daily. She's not having it daily because that would have been 7 days a week. She said she had to use her rescue inhaler 4 days in a week. And then severe persistent is not only are they having the symptoms every day, but they're having it throughout the day. So this patient falls into the mild persistent phase. So in the mild persistent phase, we treat them with a SABA, which is your short-acting beta agonist, and then you add in a low-dose inhaled corticosteroid. So if she has a rescue inhaler, that is your SABA. So she's already on that. So we want to add in a low-dose inhaled corticosteroid. Number 2 says a 67-year-old male presents to the office complaining of chest pain and a fever while driving home. He states that while at the grocery store, he suddenly felt ill. He states that he can't quit coughing up this brownish-like sputum. The nurse practitioner assesses the patient and notes his blood pressure is 86/60. What is the best treatment option for this patient? So the question is, the stem, I should say, is what is the best treatment option for this patient? So again, we're looking for the best treatment option for this particular patient. So what he described sounds like community-acquired pneumonia. Why do I say that? Y'all know Brittany's brilliance and the little funny things that I had to come up with to retain things. But with community-acquired pneumonia, which is CAP, C-A-P, they have, abrupt symptoms. Suddenly they have things. So suddenly he felt ill. He has the brownish-like sputum. He has the fever. He has the chest pain, the pleuritic chest pain. And I always say to you guys with Brittany's brilliance that CAP, hey girls, we didn't have time to really get anything done in our head because we had to suddenly run out the door and we threw our cap on. So I say that. So remember, we threw our cap on to run out the door. And with community-acquired pneumonia, you suddenly have symptoms. Crazy, but it works. Also, so when you're trying to think about how to treat these patients, you also want to do your CURB 65. You could either do CRB 65 or CURB 65. And with this, you have various things that come into play with this, okay? So with CURB 65, this is going to show you if they have 2 or more of the things listed, you want to put them in critical care units like ICU or whatever. But also, remembering with DRSP, with multiple comorbidities, etc., then you know how to treat those patients. So the C is for confusion. Are they confused? They didn't say anything about confusion. The respiratory rate being greater than 30. Didn't say that. And I skipped U, but the urea is like the BUN, so we didn't have anything telling us about the kidney function. But the B stands for blood pressure being less than 90 systolically. This person is in that category. And then the age of 65. So this person is 67. So this person has 2 of those. So they would need to be in a critical care unit. And also, you would treat with a respiratory fluoroquinolone. So levofloxacin would be your answer. The answer is C for this person. And lastly, the question says, when auscultating the patient's heart sound, the nurse practitioner hears a high-pitched diastolic murmur at the base of the heart. Which type of murmur should the nurse practitioner document? So your stem says, which type of murmur should you document as the nurse practitioner? So, okay, let's break it down. You know how I say, break it down now. So here it lets you know that there's a high-pitched diastolic murmurs. So which one are your diastolic murmurs? So you have mitral stenosis and you have aortic regurgitation. Now I do have Brittany's Brilliance. Check out some of my videos or my book or my courses for all of that. I can't give y'all all my stuff, but you know, Brittany's Brilliance, I have that. But I always tell you guys that, you know, it's so many mnemonics to memorize the murmurs. So I don't want to confuse you right now and give you something different, but just know systolic versus diastolic, you should know. Okay. And so diastolic murmurs are your mitral stenosis and your aortic regurgitation. So, okay, we already know it's going to be those two out of those two. So you're already going to eliminate answer choice B and answer choice D. And so then it says it's at the base of the heart. Okay, well, aortic is at the base of the heart, right? Mitral at the apex. So therefore, that leaves you with the answer choice C, aortic regurgitation. So I hope you found this helpful. You know, we do this every Wednesday. Meet us back here. If you have topics that you would like me to cover on Work It Out Wednesday, I will do that. And I'll work with y'all soon. Look forward to talking to you guys. Enjoy the rest of y'all's day.